Okay. Good afternoon to our Greek friends that are listening to this very long expected discussion on the spirituality and medicine, a topic that is not very often discussed. And we are very lucky and privileged and honored to have with us Mr. Robert Wall, who is an expert in this area. And we are going to listen to his presentation. As usually, we at the end will have a 10-15 minutes period of questions and answers. And it is a great privilege and honor for us and opportunity because, as I said, we hear a lot about the role of religions and Christianity, of different dogmas, different churches, the Greek Orthodox Church and health, but we know very, very few things about the role and the relationship between the Buddhist spirituality and medicine. So with this short introduction, let me tell you that Mr. Wall does have a Master of Divinity and a nursing with honors. He has published extensively. He is a member of the American Society of Clinical Psychopharmacologists, of the Hospice and Palliative Nurse Association, of the American Academy of Nurse Practitioners, the American Nurses Association. He has received many awards, and he has served in different committees and different hospitals, including the Massachusetts General Hospital and other institutions. And he is one of the leaders in this field. So with this short introduction, I would like to ask Mr. Wall to go ahead. Thank you again.
Thank you very much, Dr. Linos. It's a real pleasure to be able to speak to you and to your students. Let me screen share as a way of beginning our program this morning. This is about Buddhist spirituality, and particularly the approach toward pain and Buddhist patients at the end of life. Let's see, that's my bio. I have no actual or potential conflicts of interest in relationship to this program or presentation. The objectives are two: to appreciate the context of Buddhist experience of pain and the end of life. I invite us to consider contextualized care as a concept, the 8 ingredients of Tai Chi as applied to complementary approaches like Tai Chi or yoga, and guide our approach to contextualized care. The second objective is to appreciate the Buddhist perspective of illness, wellness, and death. We'll consider the Buddhist 5 remembrances to guide our approach to Western Buddhist patients and immigrant Buddhist and Buddhist refugees in general. I'll present one story of a Tibetan Buddhist patient when I was her primary care provider, providing palliative care and care at the end of life. It is not possible in the span of this lecture to adequately begin to describe the vast and undulating and changing and ancient practice of beliefs of Buddhism as Buddhist heritage slowly takes hold in the West. and in particular in the United States. Although there are at least a dozen cultural sources of Buddhism, I'm choosing to observe at least 4 streams of Buddhism in the West in lieu of a thoroughgoing historical overview. Mahayana Buddhism, exemplified by Japanese Rinzai and Soto Zen, Chinese Chan, Korean Sen, and Vietnamese Tien. Theravadan Vipassana, exemplified in Cambodia and in Myanmar. Tibetan Buddhism, exemplified in Vajrayana type Buddhism, family, and Shambhala. And finally, a non-sectarian Buddhist influenced, exemplified by mindfulness-based stress reduction, as practiced here and thoroughly throughout the healthcare systems of the West at this time. The nomenclature Buddhist identified contrasts differently with the Buddhist immigrant experience and practice. The two can be characterized by those who are developing a new system of practice that may radically depart from the past, contrasted with those who are maintaining a religious culture adherent to forms and practices of their country of origin. Western conception of disease and health is a biomedical approach of curing and managing disease. It includes the patient's view set in a biomedical context, and it understands that the patient's well-being cannot be divorced from the patient's understanding of well-being. When a provider of care encounters a patient with Buddhist identity, either culturally identified or acquired, successful care depends on appreciating the patient's own interpretation of illness and the helper's ability to contextualize the Western diagnosis in the patient's language, activities of daily living, religious rituals, or spirituality in order to potentiate healing and well-being. Research in cross-cultural health settings, particularly refugee health services, is making it increasingly clear that successful treatment adequately responds to the patient's own interpretation of illness, as well as biomedical categories, allowing them to actively participate in their own healing. Contextualized care, for the purpose of this lecture, is reflected in the work of Dr. Michael Groden at the Boston University School of Public Health and the Boston Center for Refugee Health and Human Rights. He wrote about treating Tibetan monks who could no longer meditate due to arousal and dissociative symptoms of trauma associated with memories of torture and violence. These images were triggered during imaginative meditation and empowerment rituals that often involved visualization. Such ritual and practice are at the core of their vocation, and unable to do this, without disabling re-trauma, the monks began to lose their faith and identity. Ensuring success of the biomedical interventions requires integrating traditional medical concepts in a way that is conducive to patient understanding and acceptance. Dr. Groden contextualized PTSD, post-traumatic stress disorder, in his patients to appreciate their shamanic doctor's diagnosis of life-wind imbalance, and leveraged elements of meditation familiar from their context to provide experience similar to their experience of meditation, but not exactly. Specifically, Tai Chi, Qigong, and singing bells were used that engaged them somatically and avoided the visual imaginary components of meditation that too easily referred to their past. He combined psychopharmacotherapy for symptoms of PTSD with these other modalities to produce a positive functional outcome for his patients. Dr. Peter Wayne at Harvard's Osher Institute has conducted research on the effects of Tai Chi. In his book, Harvard Medical School Guide to Tai Chi, Dr. Wayne has proposed 8 active ingredients operating in the action of Tai Chi that are meant to connote the active ingredients like parent compounds in medication that work symbiotically to confer an effect. He likens these to help us understand what is occurring in complementary modalities like Tai Chi. 8 ingredients are awareness, intention, attention, active relaxation, strength and flexibility, freer breathing, embodied spirituality, and social support. As an example, I'd like to suggest them here to help us understand and interpret the underlying effect of Dr. Grodin's contextualized care using Tai Chi. On one side in bold, we have the Tai Chi form itself being taught that engaged the active ingredients of breathing, awareness, and improved strength and flexibility. The singing bells invited awareness, intention, and active relaxation. Qigong engaged in embodied spirituality shared with the surrounding landscape. Social support, freer breathing, and active relaxation. To repeat, successful care, therefore, depends on adequately responding to the patient's own interpretation of illness, as well as the biomedical Western conception of health and disease. The patient's well-being cannot be divorced from the patient's understanding of well-being. When a provider of care encounters a patient with Buddhist identity, either culturally or acquired, successful care depends on appreciating the patient's own interpretation of illness and the helper's ability to contextualize the Western diagnosis in the patient's language, activities of daily living, religious rituals, or spirituality to potentiate health and well-being. Buddhist conception of health and disease holds the role of the Western-trained doctor to cure disease, and the role of the shamanic doctor to create the conditions for health that are located in both the patient and the community to which the patient belongs. Both are complementary. For example, indigenous care is seen in the Cambodian Kru Khmer, or medicine person doctor, and involves instructions on taking medicines that are highly detailed and ritualized. They provide specific indications, time of day, environmental setting, and ritual practices to potentiate efficacy. I'd like to present a Tibetan patient whom I took care of. I'm going to review the highlights of this case and then tell the story. Tenzin is an approximately 79 to 80-year-old female, a Tibetan immigrant, married and living with her son, age 55, and her husband. After the family immigrated to Boston, Massachusetts, in the United States, they moved the parents from India about 10 years ago. She does not speak English. She and family did not want aggressive measures at the end of life. A POLST, or a physician's order for life-sustaining treatment, CMO, comfort measures only, had been signed. And I saw her at home as part of the house calls program. She had a history of congestive heart failure, systolic heart failure, with an ejection fraction of 40% at the time I saw her. In time, this was 10 years ago that I took care of her. So we're speaking about her in the present, but it took place in the past. She had osteoarthritis of both knees, had some sciatica from degenerative joint disease, and lower extremity edema secondary to her heart failure. Her complaint was chronic knee pain. She had some new shortness of breath with associated fatigue and was not responding to medicine, and she felt cold all the time. In terms of osteoarthritis, palliative pharmacotherapy, it was a treatment target of nociceptive somatic and neuropathic pain. So a cortisone injection was helpful, but it was limited with relief only lasting 2 weeks. Ibuprofen with acetaminophen at low doses had limited efficacy. And gabapentin, unfortunately, had no effect for her neuropathic pain. Her congestive heart failure with fatigue and dyspnea was treated over the course of 10 months. Diuretics and cardiac medications failed, and she declined taking pills. She remained euthyroid. Morphine for dyspnea was too sedating, and the family called me one day as she had declined, and while there, Tenzin died. The 5 remembrances. As a scaffolding to tell Tenzin's story, I will use these traditional verses called the 5 remembrances that are recommended by the Buddha to be recited daily. I am of the nature to grow old. There is no way to escape growing old. I am of the nature to have ill health. There is no way to escape having ill health. I am of the nature to die. There is no way to escape death. All that is dear to me and everyone I love are of the nature to change, and there is no way to escape being separated from them. My actions are my only true belongings. I cannot escape the consequences of my actions. My actions are the ground on which I stand. These 5 remembrances sound to Western ears as depressing, but when taken in a spirit of non-fear, they provide a way for death and change to teach us about fully living. I am of the nature to grow old. She is Tibetan and lives with her son and family. And age 79 or 80, her legs have carried her across the Himalayas into India, with her sons variously being carried and helped over the arduous terrain and biting cold. Now, she sits on the edge of her bed, cloaked in fleece and woolen clothes. Her dark hair is braided with yarn of red and blue strands flowing midway down her back. She sits most of the day with her prayer wheel held in one hand, turning in small circles. This Buddhist practice of turning a small wheel with a metal container attached to a handle is a form of praying. There's a small paper parchment inside the container with the blessings written on it in calligraphy. Each time the wheel turns one rotation, the blessing is energetically sent out into the world for the benefit of all sentient beings. It is a repetitive ritual of prayer whose simple exercise helps her maintain a deep connection to the world and to the community to whom she belongs. I am of the nature to have ill health. My visit today is to assess her pain and adjust her medication and authorize acupuncture that she finds helpful. She feels cold all the time, and her simple solution is to bundle up. But this makes her sweat and causes her skin to feel colder. Often with age, the temperature regulation of the body is thrown off and registers incorrectly, causing the sensation of cold in the absence of fever. We had checked her thyroid, and it was normal. She was euthyroid. She complains of pain in her knees that ache constantly. She has a bothersome tremor in both legs that fragments her sleep, and she is not on any medication that would cause this. She complains of discomfort burning down the right side of her leg. She tells me what she wants. In her Tibetan broken English, cortisol, as she brings her palms together. Her son translates she's asking for an injection into her knee of cortisone, an anti-inflammatory steroid, and she had had an injection about 1 month ago and it helped. But it is not prudent to give steroids more than every 4 to 6 months because it's suppression of the adrenal system. And I must tell her, no, this is not possible. I also notice speech dyspnea when she speaks longer sentences in Tibetan to her son. It is good when approaching a Buddhist patient to inquire of them what their practice is in order to appreciate it in whatever ways brings out your best. Her religious practice is not the esoteric recitation of the Heart Sutra, referring to form and emptiness being one and the other, but rather she practices with a prayer wheel that cultivates the concrete ethical components of the Buddha's Eightfold Path. 3 of these can be readily identified: right action, right effort, and right speech. These are in the foreground of the way she responds to her discomfort, and they are expressed in her Buddhist prayer wheel practice and in the way she speaks to me and requests help from me. From the Western biomedical approach, she has osteoarthritis, sciatica, and congestive heart failure. I gave her low doses of gabapentin for sciatica-related discomfort, but with no effect. Ibuprofen combined with Tylenol were judiciously administered, but with low efficacy. Then oral morphine for shortness of breath, which she was very sensitive to. So I reduced the dose from a standard of 0.25 milliliters to what amounted to a homeopathic dose of 0.0625 milliliters, a drop, and it was too sedating. Contextualized care appreciates integrating interventions that are congruent with the patient's beliefs about health and illness. I asked her son, an ordained lama or monk, to pray over the medications as part of the ritual of scheduled daily medication. Sedation went against the patient's need to maintain her concentration. She would prefer pain over sedation when given the choice. When the medications continued to have side effects, I stopped them. And I brought in an acupuncturist 3 times a week using needles and moxa therapy. Moxa is a small compacted cone of herbs that burns from the top down, causing a mild heat on a specific point as it burns down. It is placed on the skin and is removed prior to actually causing a burn. The process is called moxibustion. This intervention decreases inflammation safely and with little to no side effect. Its mechanism of action is not well understood. It was congruent with the patient's beliefs about drawing off heat from the knee and the power of the incense-like moxa to calm the atmosphere so that pain would shift. It could be offered in the context of her prayer wheel that would potentiate it hypothetically because of prayer and meditation's effect on the sympathetic nervous system. She liked it for pain, but it did not help her other symptoms. Over the months, her condition began to change and she weakened. She was not getting out of bed. Her appetite was less. She became deconditioned. And the family called me to visit when she began sleeping more and no longer using her prayer wheel. I am of the nature to die. When I arrived, her 2 sons were present. The kitchenette and living room were combined. A dining table was off to the side. Many books lined one wall. In an adjacent room to the living room where she lay, on the floor, a monk was prostrated, chanting amidst burning incense, a ritual of prayers for the sick. On the family cadenza is an altar on which sat 10 crystal glasses of water arrayed together with electric votive lights. She lay on her bed in the living room next to her husband's cot. She was minimally responsive. Her face did not show pain. Her breathing was regular, shallow, not labored or distressed. It did not occur to me that she was actively dying and very near. I was speaking with her son when it seemed to us that there was some shift or change in the room. We looked toward her, and she was still. I found no heartbeat, no breathing, no oxygen saturation. She was gone. Several things happened. Her son spoke to her quietly, and when she no longer responded, he looked to me, and I could only hold my palms together and shake my head. He could not believe it. In the Mahayana Buddhist practice, Thich Nhat Hanh speaks about birth and death using different analogies from nature. It is the Buddhist view of immortality, called no coming, no going. I will offer two of them because my hospice families, whether Buddhist or not, find these helpful. The first is an analogy of the ocean wave. When we look at the ocean, we see that each wave has a beginning and an end. Waves can be recognized by signs, high or low, beginning or ending, ugly or beautiful. But in the world of water, there are no signs. And of course, we see that a wave is made of water. As the wave approaches the shore, if she does not realize she is water, the wave will see herself receding and disappearing. But when the wave touches her true nature, which is water, fears and worries of things ending are held together with the insight of no coming and no going. The wave never dies. The cloud. The second analogy. In our minds, to be born means that from nothing we become something. And to die means from someone we become no one. But a cloud can't be born. It has come from the water in the rivers and oceans and dust and the heat of the sun. Myriad conditions have helped create it. A cloud can never die. It can only become rain or snow. When we are caught in the idea of a lifespan, we think, my life will only last a certain amount of time. We start asking questions like, did I exist in the past? What was I in the past? When I die, will I still be there? And if I am, what will I be? These questions only arise when we are caught in the ideas of self, human being, living being, and lifespan. Our difficulties arise when we forget this teaching and become attached to ideas and to things, believing that they are independent and permanent. In the Buddhist view, the wave and the cloud help us see the reality that wave and cloud, like ourselves, are empty of a separate existence apart from all the conditions that make them and us arise. Acceptance of this concept within an embodied experience often results in a sense of non-fear. The Buddhist view names this insight emptiness. Everything and everyone is empty of a separate self. It could be as truthfully called the fullness of everything. Touching life deeply, we see both the relative dimension that we die and the ultimate dimension that we never die. If you have realized the truth of emptiness, you can share the gift of non-fear with others. This is a precious gift that can be helpful to somebody who is dying. All that is dear to me and everyone I love are of the nature to change. There is no way to escape being separated from them. Their grief was expected. Her other son, who had lingered in the background, began to speak to his mother, and turning away in grief, then speaking to her as if in disbelief she could no longer hear his voice. And he too looked to me and found no reassurance that it could be otherwise. I was asked to tell her 80-year-old husband who sat nearby. He stopped his prayer bead practice and lumbered over to her body, touched her face tenderly, and said something to her, and nodded his head. He came back to his chair and nodded his head to me, and took up his prayer beads again. I read sadness and acceptance in his face. The monk in the other room began a new and different set of chants for the dead. This is because the tradition guides the family both during times of sickness and at the times of death. The chanting and prayers made the room where she lay a quiet, stable place. This was the effect while she was sick, and even more so once she had died. My actions are my only true belongings. I cannot escape the consequences of my actions. My actions are the ground on which I stand. This is the Tibetan Vajrayana universe. At the time of death, the body and mind have dropped away, but the consciousness of the loved one does not drop away as much as it drops into the ocean of consciousness of her family and Sangha that are themselves diverse and unique manifestations. The sum of one's own energy at this point begins to transform and is augmented by the community so the departed can move on and can move through this transformative process and appear on the other side. The other side or other shore is not a place as much as a state of compassion consciousness from where one can take up another human birth. The transformative process traditionally takes 49 days. Thus, at death, it is most helpful for the loved one to have the conditions of ease, concentration, relaxation, and non-fear present. As one's concentration diminishes and all the boundaries drop away, the energy now shifts in large part to the Sangha, the family, friends, and monastic community to carry the loved one to the other shore. One way this is done is by chanting and prayers and by using the loved one's favorite and familiar means of practice, in Tenzin's case, her prayer wheel. The monk picked up her prayer wheel and continued to accompany her, making this action for her. The time of transition at death varies from person to person because each of us is influenced by what we have done, the emotional conditions and attachments at the time of death. At death, the consciousness can be strongly left attached to the body, which has become insubstantial ground on which to stand. So the Sangha, the family and community, takes over and performs acts to support her non-fear and continued awakening. Following her death, her family washed and dressed her and continued to let her body lie in peace in the family apartment. Ceremonies were chanted for 2 to 3 days, and then her remains were cremated. Small portions of her remains were mixed into plaster and formed and baked into a mold called a stupa that can fit in the palm of your hand. Tenzin's stupas were sent to monasteries in India and to the many, many people she had touched in her lifetime. She had been known as a person of great holiness in her Tibetan community here and in India. And because she chose to pass from this life when I was present, the family felt, for reasons they did not know and I did not understand, that I should be given a stupa as well. This concludes my presentation on Buddhist spirituality and medicine. To review, we have touched upon certain aspects of Buddhist practice and insight. They have been taken from a vast, undulating, ancient system of belief and cultures that far exceeds any single presentation to represent. It is the case that the Buddha's teachings and their effect on patients in a modern idiom can be framed as a cognitive, behavioral, and spiritual system of teachings and practices. These continue to grow and develop to this day within the immigrant and Buddhist identified adherents. We have used the concept of contextualized care to remind us that the patient's success depends on our adequately responding to the patient's own interpretation of illness. We interpreted complementary approaches of meditation and movement modalities using the 8 ingredients of Tai Chi schema. The story of Tenzin was told against the 5 remembrances of Buddhist practice, with analogies drawn from nature in the wave and the cloud, in order to appreciate the effect of this framework to cultivate non-fear and acceptance. And finally, we appreciated the particular rituals at the end of life in a Tibetan family. Thank you for your kind attention. A selected bibliography of references for this presentation are offered separately. Thank you.
Thank you so much. Thank you indeed for such a new information offered to us. And we appreciate putting all these things together in such a relatively limited time. Allow me, Mr. Wall, to read to you some questions that we have for you, if you may. The first one says, can you discuss the difference between Buddhist identified and Buddhist immigrant?
It's a good question. The Buddhist immigrant, of course, comes as a refugee to your country, my country, to Europe, from wherever, and often they're from Asia and the Asiatic countries. So they bring with them culture and ritual and religion that they begin to establish once they've arrived in their new country. This is the Buddhist immigrant, and they have a very different experience of their Buddhist language and as it applies to their daily life as they enter into a very different culture like the United States, for example. Whereas somebody who's Buddhist identified acquires this identity over time through reading, through exposure to other people, and or to other forms of Buddhist practice in the West. So, for example, myself, I became acquainted with the Zen master Thich Nhat Hanh and met him in a context of a retreat and felt that this was an expression of something very deep inside of me. And so I went into a process of gradually identifying with Buddhist practice as he interpreted it in small groups and communities, and particularly monasteries here in the West. Some people, like myself, with a Buddhist identified self, will say, no, I'm not a Buddhist, but I have a mindfulness practice or a Buddhist type of practice, but they won't really define themselves as Buddhist. So when you meet them in the hospital, they may be listed as Christian, but they may have at some deep level a mindfulness practice, which is drawn from Buddhist insight and often from contemporary writers. They may indeed belong to a Sangha, a Buddhist practicing Sangha, but not identify as Buddhist. Whereas the Buddhist immigrant will identify fully with that and with the traditional language and rituals of that practice. Finally, in the hospital setting, a Buddhist immigrant would not ask for a chaplain because in their mind, they don't know what a chaplain is. They normally don't see chaplains, and chaplains are a form of colonial Western Christian missionary experience. What they most appreciate is a friendly visit for sure, and the monks and the nuns of the temple where they live, while they're sick, are offering prayers and rituals on their behalf, and that's where the spirituality really lies, in their family and in that monastic sangha that supports them while they're in the hospital. Another question?
Yes. You mentioned analogies of the wave and the cloud to explain the Buddhist view of immortality.
Mm-hmm.
Is that different from the Western Christian conception of immortality?
That's a good question. It is and it isn't at the same time. The Western Christian conception of immortality is something that is conferred as a gift of grace by God. It is something that the Christian community, the church, celebrates and recognizes as being present and is actualized through baptism. And so through baptism, the child is brought into the family of Christ, the church, and continues to be marked or shaped by that community to whatever degree of expression of faith that they come to throughout their life. At the end of the life, the church is still there to celebrate that person's life and their being enfolded by this gift or grace of God, which was there before they even were born. And so it remains present. And in the Christian immortality experience, we bring the body of the loved one to the altar, to that moment, and then to the burial. And our relationship there kind of stops, and we let God take from there. The person's with God, the person's in God's arms or whatever. In Buddhist view of immortality, all of that is happening. The child is born into a family, into a sangha. They're brought into the sangha and into the relationship of one another, and they're taught the Eightfold Path, the pathway of right speech, of right view, concentration, developing diligence, developing action, and having a livelihood that is ethical. And so at the end of life, nature teaches through the cloud and the wave, as I gave these examples, that in fact, there is no beginning and end of one's life. One is formed and is never separate as a self, never a separate self, but that you're always a product and an expression of your ancestors and your family, your loved ones, your teachers, and people, animals, plants, and minerals, the entire planet and cosmos. And you're an expression of that, so that you have no separate self that's existing that would go anywhere. you're always enfolded into the peace, which is this entire life. So like the cloud emerges, as we know, and then it disappears, as we know, but it just changes forms and transfers from one form of water into another: evaporation, cloud, rain, lake. And so that's used as an invitation for us to consider how we also transform from one form to another. And this experience of non-fear, of not having fear about any and all of that, then becomes a kind of soil and a ground in which this insight into no separateness, this insight can grow. And that becomes immortality. And so we see it from two dimensions: the relative dimension, which is me and my name and my characteristics and who I am. And yet as an ultimate dimension, me as all that I've eaten and all that I am breathing, and all that my ancestors are, and all my friends and family and the people who've made me who I am. When you see me, you see all of that too. And that's the ultimate dimension. Yeah. In the Tibetan Buddhist framework, though, the work of relieving suffering is endless. And there is some distinction made that in some sense, there is an I that is invited back. And so we think of that as rebirth. And in the Tibetan universe, that is a part of their experience. Mm-hmm. But in the Zen universe, they don't tend to appreciate that as much or emphasize that as much. It's enough to say that everything is one and there is no separate existence. You never go anywhere and you're never alone. You see me, you see everything, you see a hair, you see the entire cosmos. So it's an invitation to look deeply into immortality from both the Western Christian conception, which has its own beauty and depth, and the Buddhist immortality, which has its own beauty and depth. And the two of them combined together, I think, help us approach life to live it fully without fear. Yeah.
There's another similar, I think, question, probably you have already answered, but I will read it to you. Is there an eternal life after death in the Buddhist teaching as it is in the Christian faith?
Mm-hmm. Mm-hmm. Yeah, I've touched on that. When the Buddhist dies, there's a traditional period of 49 days. That is, the person is still here, but they're not here in the form that we knew. And so in English, we'll just call that consciousness. There's some energy or consciousness that remains. And to the degree that they've been very attached to this life and to their body, the consciousness doesn't leave the body as easily. So they have 49 days during which the church or Sangha, the family, and the monastic community take up the rituals at that time to accompany the person as they leave their body and they move on to the other shore. So there's an accompaniment and very active kind of being with, speaking to them, praying to them, praying to ancestors who were close to them to help them. There's a sense that they're nourished by the loving action of the community. And that continues for 49 days. And then, and early in that time, usually in the first 7 days, the person is cremated. And so it's those cremated remains that, in her case, were formed into a small stupa you could hold in your hand. And and buried, and then continued 49 days. And these are every 7 days for 49 days. These are rituals of remembrance of the patient, of the person. In the Christian conception, we will probably have a mass, every year, an annual memorial, that kind of thing, after the burial and funeral. Mm-hmm.
Yes. I think we have time for just one more question. Mm-hmm. And the question is as follows. The story of Tenzin describes the role of the monk and family accompanying Tenzin after she dies. This is a unique concept. Can you say more about this?
Mm-hmm. The monk in the other room, because her son was a monk and a high lama, for example, when the Dalai Lama comes to the United States and comes to Boston, her son is on the dais with the Dalai Lama as one of the head monks welcoming him to Boston. And he is one of the head monks who has pastoral responsibilities for the care of the Tibetan diaspora in New England. So he was very important. I don't know that every Tibetan family would have a monk come to their apartment, but because of who she was even more famous than her son. Without going into all of that, which I didn't know at the time, the monk in the next room, which was a bedroom, had set up the bedroom for these empowerments. Now, at the beginning of my talk, Dr. Grodin had worked with Tibetan monks who could no longer perform empowerment rituals because they required imagination and visualization, which re-traumatized them. Therefore, they couldn't perform their work, their life, their identity. Now, this monk is doing that. He's performing a visualization, a chanting, empowerment ritual to support her. And then after she dies, he continues doing that, but he has changed the tone, the chanting itself, and the scale of the music, so to speak, is changed. And incense is lit, and so this is the beginning of the first 7 days of rituals to help support her as she's leaving and going on and taking up a rebirth. And so that becomes important for the accompaniment of the loved one. And that's a unique concept where we don't necessarily think about accompanying those who die. We go up to the grave and we put the earth in the grave itself, we close it, and that kind of helps to close that life. And then we go on and remember them, but we don't necessarily accompany them because in the Christian faith, there's a faith that God has taken them and he's God's hand, so we don't need to do anything more. So that's a unique concept, this accompaniment.
Yes, great. Well, we again want to thank you so much for this unique presentation, and I hope next time you visit us in person in Greece. Thank you so much.
I'd love to do that. Thank you. Thank you for your kind attention and your invitation. Thank you.
Thank you. Bye-bye.
Bye-bye.